Welcome to our detailed video on knee replacement surgery. In this video, we'll cover everything you need to know about knee replacement, including the causes that lead to knee damage, the treatment options available, both medical and surgical, the recovery process, and prevention strategies to protect your knees and keep them healthy. If you're dealing with knee pain or considering knee replacement surgery, this video will provide you with all the information you need. Key points covered. 1. What is knee replacement surgery? 1. Knee replacement surgery, also known as total knee arthroplasty, is a procedure in which a damaged knee joint is replaced with an artificial joint made of metal, plastic, or ceramic. 1. This surgery is typically performed to relieve pain and improve function in individuals suffering from knee joint degeneration, often due to arthritis. 2. Causes of knee damage leading to replacement. 1. Osteoarthritis. The most common cause of knee replacement, osteoarthritis, occurs when the cartilage in the knee joint breaks down, causing pain, swelling, and stiffness. 2. Rheumatoid arthritis, an autoimmune condition that causes inflammation in the joints, leading to joint damage over time. 3. Post-traumatic arthritis. Knee joint damage caused by a previous injury or trauma, such as fractures or ligament tears. 4. Avascular necrosis. A condition where blood flow to the bone is reduced, causing the bone tissue to die and leading to joint collapse. 5. Knee deformities. Congenital or acquired deformities, such as bowed legs or knock knees, can lead to abnormal wear on the knee joint, necessitating replacement. 3. Treatment options for knee pain, medical and surgical. 1. Non-surgical treatments. Physical therapy. Strengthening the muscles around the knee, improving flexibility, and enhancing joint function through targeted exercises. Pain medications. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or acetaminophen to reduce pain and inflammation. Corticosteroid injections. Steroid shots to reduce inflammation and provide short-term pain relief. Hyaluronic acid injections. A substance that lubricates the knee joint to reduce pain and improve mobility. Braces and supports. Wearing knee braces or supports can stabilize the joint and help relieve pain during daily activities. 2. Surgical treatments. Partial knee replacement. In cases where only one part of the knee is damaged, a partial knee replacement may be performed to remove the damaged section and replace it with a prosthesis. Total knee replacement. This is the most common form of surgery where the entire knee joint is replaced with a prosthetic joint. Minimally invasive surgery. In some cases, smaller incisions are made for knee replacement, which may reduce recovery time and scarring. 4. Knee replacement surgery recovery process, recupero. 1. Immediate post-op care. After the surgery, you will be monitored in a recovery room. 1. The first 24 to 48 hours may include pain management, ice therapy, and elevating the leg. 2. Physical therapy. Early physical therapy is essential for a successful recovery. 2. The goal is to improve the range of motion, strengthen the knee, and get you walking again. 3. Pain management. Pain will be managed using medications such as opioids, NSAIDs, and physical therapy interventions. 3. Ice packs and elevation will help reduce swelling. 4. Walking and mobility. Most patients begin walking with the help of a walker or crutches within a day or two after surgery. 4. Weight-bearing exercises are gradually introduced. 5. Returning to activities. It usually takes 6 to 12 months to fully recover from knee replacement surgery. 5. However, most patients experience significant pain relief and can return to daily activities and low-impact sports. 6. Follow-up appointments. Regular follow-up visits with your surgeon are crucial to monitor the progress of healing and to check for any potential complications, such as infection or blood clots. 5. Prevention of knee joint damage. 1. Maintain a healthy weight. Excess weight puts extra strain on the knees, increasing the risk of developing osteoarthritis and other knee conditions. 2. Exercise regularly. Low-impact activities like swimming, cycling, or walking can strengthen the muscles around the knee and improve joint stability. 3. Proper footwear. Wearing supportive shoes that provide cushioning and proper alignment can reduce the stress on your knees. 4. Avoid high-impact activities. High-impact sports, such as running on hard surfaces, can increase the risk of knee injury and long-term damage. 5. Stretch and warm up. Warming up before physical activity and stretching after can prevent injury and keep your joints flexible. 6. Use assistive devices for joint protection. If you have knee pain or arthritis, using knee braces or supports can reduce strain on the knee joint and prevent further damage. Takeaways. 1. Knee replacement is an effective solution for severe knee pain and joint dysfunction, especially due to conditions like osteoarthritis or rheumatoid arthritis. 2. Both medical and surgical treatments are available to manage knee pain, and surgery is considered when conservative treatments no longer provide relief. 3. Recovery from knee replacement surgery requires dedication to physical therapy, pain management, and follow-up care. 4. Prevention is possible with lifestyle choices like maintaining a healthy weight, exercising regularly, and avoiding joint stress. Don't forget to like, share, and subscribe for more informative health videos. If you have any questions or comments, leave them below. Let's work together to keep our knees strong and healthy. eTech for you.